Okay, Chapter 5, Immunoassays. You had exposure to this in immunology. Same thing, we're going to describe methods. And as you should know, you're detecting what? Antibodies or antigens, okay? And just be aware, sometimes you don't have antibodies to something. You have the antigen, and we want to measure that, okay? So we need antibodies from someplace else that are going to make the complex, the antigen-antibody complex, okay? Immunoassays are very sensitive and specific, and most of them are enzymatic, fluorescent, or chemoluminescence. Okay, and that's what we're going to talk a little bit about. And you know these terms, but just to refresh yourself, the antibody is the immunoglobulin, and it is specific to an antigen. And the antigen is what reacts with an antibody. So if it doesn't come from us, it could be chemically induced somewhere else, okay? And that's where these come into play, okay? The chemicals that we might utilize in this reaction. When we talk about them, for the most part, we're referring to the patient having the antibody, and the antigen will be introduced artificially for the complex. But just keep in mind, it could be the other way around. Okay. Monoclonal means it comes from one plasma cell line as opposed to polyclonal. Okay. If it only comes from one place, it's going to be much higher specific for an antigen. And here's showing our reaction. It is reversible. But for the most part, this is what we're going to measure. And kinetics specifically we'll be talking about later in a different chapter. Okay, we use labels. That means we tag something that we can measure to an antigen or antibody. Okay, just keep that in mind. And it could be like a fluorescent label. That the method we just talked about is going to emit a light. So they're called labels, tagged, or possibly detector. That's what we're actually measuring. It's not usually the antigen itself, but it's attached to that antigen. These are some of the chemicals that we actually use for labels. Peroxidase, you're going to get familiar with some of these names, okay? Peroxidase is a very common one. Peroxide, okay? Alkaline phosphatase we use a lot. Under fluorescence, we'll use actinium, luminol for the most part. Okay, those are chemoluminescence. Three main techniques that we're going to introduce. Enzymes, you will see it's abbreviated as a microparticle enzymatic immunoassay. And we use MUP, which is a phosphatase, alkaline phosphatase. This is chapter 5. Okay. Fluorescence, we're producing the light. Okay. Umbelliphone is one that we use. Chemoluminescence, we're also producing light. We are oxidizing from peroxidase, and luminol and actinium. This is some of the same information that was on that chart I just showed you, okay? Let's talk about competitive binding. Do you remember hearing that last semester? Competitive binding? You probably did some methods that had this. We have And there again, remember, it could be the opposite. But we have a labeled, a tagged antigen, and it's going to compete with your patient antigen to bind on a total separate antibody. Compete. So that means either this labeled antigen or your patient antigen are going to bind on the antibody. Okay, it's competition. Who gets there first? Something you need to note is excess antibody and antigen are not bound. Okay? So if I have a whole lot more antigen than I do antibodies, the extra isn't going to be bound up someplace. It's going to get washed off, discarded. So that we are usually only measuring one portion. Homogeneous, we're only going to measure a total as opposed to the portions free or bound. And some of that doesn't make sense yet, but when we get into the different analytes, I'll start bringing that out, especially the ones that we measure by this, like thyroids or different hormones that we talk about. Just keep that in the back of your mind and it'll come back. And we can use a solid phase material. We already talked about solid phase with thin layer chromatography. We can use something like that. A bead or particles. You guys did you do a red cell assay in immunology? Something that was red and you were looking for clumping or something? Okay. I think you did. Or particles or something. We used to use great big little BBs. I mean, there's no doubt. You could see them. We had to put them in test tubes. And they were coated with an antibody or an antigen. Okay, solid phase is this. Call it a bead, a gel, little bitty magnetic portions, and we are going to use those on our instrument. It's got metal beads that stick to a magnet. Okay. Did you have something that was black or brown, grayish, charcoaly looking? I know one of those test kits has something like that, and that's what. You probably did a rotation and you're looking to see, did it start sticking together? That's basically what this is talking about, okay? Only we're going to stick them in a piece of equipment, and they're going to read it much better than your eyeballs did, okay? This is showing you the reaction, and this is in your textbook. And here is our antigen. And see the little labels are those little indentation, or those protrusions sticking out, the little pluses. That's the flag that's going to be measured. Okay, it's not taking part in the reaction. And here's our patient. You know, they look just like they're the antigen. And they're going to come over here as an antibody somewhere that we've added to our sample. And both of them are going to compete and try to bind. So here is your competitive binding. Some of them have your labeled and some of them have your patient. Okay? So we need to have plenty of antibody so these guys can do their competition. So they have even field. Plenty of antibody so that they can tag to. Then we go down here and we've got some just floating out here. Well, we don't want to measure those labels that are not attached, right? So we're going to wash them off, get rid of them, and it is just a wash. You have some kind of wash solution that you introduce and then you pour it off. This is showing you the solid phase. All these antibodies are on something like a bead, and so they don't wash away. Then the ones that have the flags on, we're going to come over here and measure. The flag is what we're measuring. So by statistics, you can kind of say, okay, if I've got 1 in 4 that are flagged, then that means I got 3/4 that are patients. Okay? Because I know how many antibodies I have, and I know how many flags I put in, so whatever's left plus what was washed off should have been that amount, so I can deduce how many is my patient. This particular one, I'm going to get a low signal because I've only got 1 in 4 that are flagged. So my signal is going to be way down here. I don't want you to pay too much attention to that line yet. But your signal will be low. I've got a lot of patient. So that's kind of inversely related, right? Low signal means I have a lot of patient. Right? Say yes. Okay. This is showing you the same thing. Here's my flag and my patient antigens. Going to attach to these antibodies on this solid phase. Okay, competing, and then wash away these surplus, and that's surplus patient and flags. This one, 3 are flagged and 1 is patient. That's going to be a high signal because I have a lot of flag attached. Means I have low patient. Same thing, inversely related. High signal means low patient. Okay? That was competitive binding. I have a labeled antigen and a patient antigen competing for the sites. I'm only going to measure the label. So inverse to the concentration of your patient. Now the other method is non-competitive, and it's called a sandwich method. We're still going to use the same kind of principle. We have 2 antigens and 1 antibody, or vice versa, 2 antibodies and 1 antigen. But instead of competing, we're going to label and sandwich the antibody in between the 2 antigens or the antigen between the 2 antibodies. Think bread and meat. Okay, in this diagram, we have 2 antibodies. Okay, so the antibodies are the bread, top and bottom, and the antigen's the meat, stuck sandwiched in the middle. Okay, so we call it a sandwich. Okay, and we're still using a solid phase. So we have 1 antibody identified some way, and the antigen attaches to it. Then we introduce another antibody, and this one has a label on it, and it's going to bind to the other side of this one, the antigen, and that's what we're going to measure. Okay, now the patient can be the antibody or the antigen. In this instance, the label is an antibody. Okay, and you have a picture in the same format. I need to inversely or directly proportional concentration. What do you think? Directly proportional. Okay? Because my patient and my label are all in the same complex. So however much patient I have, I've got that many labeled in that complex. And I'm going to measure the label, so for every label I got a patient, whether or not it's an antigen or an antibody. Okay? So sandwich is directly, competitive is inversely. They're just the opposites. And you need to know that to understand what's happening in your reaction. If it is going to be a sandwich, a non-competitive as opposed to a competitive. Those are the 2 main. They might call them other fancier names, but that's the bulk of it. we have a phenomenon called the hook effect. And you probably talked about a prozone effect on what you were visualizing. This is on the equipment. You got to have a surplus. If you don't have enough, then all of your patients doesn't have enough opportunity to get bound. So you're going to have a lot of excess patient that you're not measuring on both of these, really. Okay? So whatever they're binding to, you have to have plenty of it. So on your curve, if you will, think about it like that one that was dropping off. Okay, I have plenty of a binding going on, and then all of a sudden I don't. Okay? So we need to know when we get there. And sometimes we can't necessarily tell. Now, our instrumentation is great about giving us error messages saying there was a reaction still happening, and I didn't have a bottom out point or a stopping point. So you probably have more than you actually bound. So in that case, we do a dilution. We bring down our patient amount down, dilute it enough so that the reaction will have plenty of other entity to bind to. And that's called the hook effect, okay? Even though this is saying excess antibody, it could be antigen. So whatever is binding, you got to have excess of it. The one that's the commercial product. I just threw two more things in because this is very applicable to immunoassays. Sensitivity and specificity, and we talked about those last semester. And sensitivity is, we got an N, so we're thinking positive. We want our test to be positive if we have the disease, right? So the more sensitive it is, the better likelihood that's going to happen. We'd love to have 100% sensitive. Every person that has the disease, we want it to tell us. It doesn't happen. There's no 100%. But we do math, calculation, statistics to figure this out. And you need to kind of learn these. We're trying to calculate how often we detect the analyte when it really is a disease. Okay? That means we're going to have true positives, that's when we have the disease, as opposed to false positives or negatives. For this math, we're looking at how many times do we get a false negative. That means they have the disease and we said it was negative. Okay? It's a false negative. So they should have been, we wanted them to be true positives. So how many times do we have a false negative? And, you know, sometimes we don't know that. These studies are really hard to do because you got to have patient information and contact down the road. You know, when do they get diagnosed? When do you know they really have this disease? Because there's a gray window, and we want to reduce that gray window as much as we can. So we want to find a way to measure something so that we get as many of the true positives as possible. So if we use this formula, it will tell us how sensitive we are. So try to remember this. I told you to use the N and the P. Here's an N. So we're going to use the false negatives to find out sensitivity. Now specificity represents negative in absence of disease. I'm not going to test positive if I don't have the disease. Okay? And there again, we want 100%. We don't want to be getting false positives telling people they have this disease when they don't. Okay? FP is false positive. So we want to detect how many are false positive. And you always hear about people that say they have a disease and then lo and behold they don't. You know, they didn't get well. The test said they had it. okay, or whatever method they were using to diagnose. And of course, we want to be 100%. If you don't have the disease, we want to know 100% with our tests. That's right. But that doesn't happen. So the closer to 100 we get, the better. So in this case, we want to know how many are false positives. The fewer, the better, because we want this to be 1. So P for positives, false positives.